they are a major problem. Self-regulation hasn't worked. In some communities, some kids, 50% of their daily calorie intake is in the form of sugary drinks. We saw that in some remote communities. And they, of course, are the communities that are suffering the most from this diabetes epidemic. And we have to turn it around. I'm a paediatrician. 20 years ago, we never saw kids with type 2 diabetes. It's now not uncommon. Every paediatrician around the country, but in particular in more disadvantaged areas, we're seeing kids with type 2 diabetes. And they often have a very rapid track to complications of diabetes, like blindness, kidney failure, cardiovascular disease. And we got some very harrowing lived experience evidence from people who were suffering from the terrible effects of diabetes, and often at young ages.
So what sort of effect would a levy on sugary drinks have? I guess it would free up more money to try to deal with this problem, for one thing.
Well, it would, but it's part of a raft of measures, and they all need to be seen as a whole. To specifically look at that recommendation number 4, we see it as a reformulation levy, so get the companies to reduce the amount of sugar in their drinks, and that has been shown to help as well overseas, and also sends a signal to everyone: these things are bad for you. They do bad things, and we don't want to have a situation where our kids will live less long than we have. In my lifetime, life expectancies have continued to increase, and we want that to continue. And we want our kids to live long and healthy lives. And this report comprehensively looks at a way of tackling this diabetes disaster that's affecting every place in the country, but it's tracking disadvantage. So the more disadvantaged areas are suffering the most. Not just remote Indigenous communities, but in outer metropolitan electorates like mine of Macarthur, or next door neighbour Werriwa, or Melissa McIntosh's seat of Lindsay. These are the places where we're seeing this diabetes epidemic really affecting the whole community and putting enormous strain on the health system.
Okay, so you hinted at it. There's 23 recommendations. Understandably, probably, the media's kind of latched onto the sugar tax line a bit, including us, guilty. But I do want to ask, some of those other recommendations, what would they achieve in particular?
Well, the marketing of highly processed foods to children is something that just has to stop. Kids are being targeted, not just on mainstream media, but on social media all the time, and then details are being kept about them, and they're targeted again and again and again, and these things are bad things. They're contributing to the obesity epidemic. We need to really stop marketing these things to kids. We need to look at food labelling. I'm health literate, I think, and I go into a supermarket, I don't know what the labels mean. There's no comparative system, no system telling you which foods are good for you, which are not. We need to change that. There's also, medical miracles happening. I've been in healthcare for over half a century, and when I started my training, people monitored their diabetes by using urine testing, which was very inaccurate. These days, with the technology, and I explained to you, I'm wearing a continuous glucose monitor, which really has a very educative effect. I now know what foods are bad for my blood sugar and bad for my health, and I can monitor what I'm eating.
It's very individualised, isn't it?
It is. Everyone's different, yeah.
Just the last one on this. It feels like we've been discussing these kind of things that you've put in there for a very, very long time in Australia, at least 10, 20 years.
20 years, yep.
Is it a job for a second Albanese government term? You're obviously not in the executive, but is it something you're going to be campaigning for internally? Hope to get it on an election platform, maybe?
I'm very proud of this report. It needs to be taken as a whole. I'm very grateful for all the efforts of all the members. I'm pretty persistent. I'm not going to give up on it.
Okay.
It needs to be looked at in more detail. I think I don't think it's going to happen in this term, and it's up for the government to decide. But all these recommendations I'm going to continue to push for as long as I'm in Parliament.
There are bigger things going on in the world, of course, than the defection of one senator in Western Australia. But I did want to ask you about it because you represent part of Western Sydney. Is her defection and the way it sort of played out in the media through the week going to be a problem for the Labor Party, do you think?
Look, I think the perception of division is never good. I don't believe my party is divided. I think that we view unity very importantly. And I know there's lots of talk about different political parties, etc. I think our government and our Prime Minister are doing a fantastic job. I think we've seen this week the tax cuts and cost of living measures. I'm grateful to be part of a Labor government. I think it'll be a great Labor government and will continue for many elections.
Do you think there was any way Senator Payman would have been convinced to stay, or do you sort of subscribe to the view that she'd made her mind up some time ago?
Well, look, I can't speak for her. I really don't know. I reached out to her, as did many of my colleagues. It'll play out as it plays out. But I'm pretty confident in my electorate that Labor will do well and will continue for several elections.